to this Health Promotion 1 activity focused on historical approaches to health in Canada. When you're ready to start this activity, you can move the slides forward by pushing the next button at the bottom of the screen. Historically in Canada, there have been three different ways that we have looked at the concept of health. First, the medical approach. Second, the behavioral approach. And third, the socio-environmental approach. Now, you've already had the opportunity to review these three approaches in your readings for this unit. So what we're going to do in this activity is do a quick review of them. The medical approach views health as the absence of disease or disorders. It also emphasizes that medical intervention restores health. Health problems are defined primarily as physiological risk factors. The medical approach to health really dominated Western thinking for most of the 20th century. Within this model, less emphasis was given to health promotion and disease prevention, and interventions focused primarily on treating existing conditions. The behavioral approach views health as the outcome of healthy lifestyle choices. The behavioral approach places responsibility for health on the individual. It was the 1974 Lalonde report titled A New Perspective on the Health of Canadians that really shifted emphasis from the medical model to a behavioral model. Around in the 1980s, there were some studies being done on the behavioral approach to health, and those studies showed that the lifestyle improvements we were wanting to see were being primarily made by well-educated and higher-income Canadians. The Lalonde report was then criticized for viewing health risks as being self-imposed behaviors. So out of that comes the socio-environmental approach to health, where health is seen as a product of social, economic, and environmental determinants that provide both incentives and barriers to the health of individuals and to the health of communities. This view sees health as not entirely an individual responsibility. The socio-environmental approach to health is closely tied to social structures. So poverty, poor working conditions, and air pollution, just as a few examples, are all recognized as influencing health. In 1986, the Ottawa Charter for Health Promotion was developed, and this is a document that supports the socio-environmental approach to health. This activity is a matching activity. You're going to be asked to read through the three different descriptions of heart disease. Next, consider the various approaches to health that we've talked about today: the medical approach, the behavioral approach, and the socio-environmental approach, and drag and drop those approaches to the correct description. On the next slide, your Unit 1 quiz will start. So at the end of each week's learning activities, we're going to have a short quiz for a total of 10 quizzes, and they're each going to be worth 2% of your final grade. So when you're ready, go ahead and click the next button at the bottom of the screen, and just remember that each quiz can only be attempted one time, and that is the score that will be tallied. This is your first quiz. Again, it's worth 2% of your final grade. So what we're going to do in this quiz is look at the three approaches to health in Canada that we talked about. So the medical approach, the behavioral approach, and the socio-environmental approach. Above those boxes, you'll see a number of blue boxes that have leading health problems by the three models of health listed in them, and your job is to sort out which of the approaches those health problems belong to. So you can do that by dragging and dropping your answers to the correct box. When you're done, you go ahead and hit the submit button. If you got all the answers correct, you'll get a note saying that you've got them all correct. If you got them incorrect, I'll give you some feedback on which ones were incorrect, and your score will be based on according to how many you got right. Alright, so you have one opportunity to do this quiz. There's no books or any other text allowed, and you'll have a total of 5 minutes to complete this activity.